Hi there, and thanks for joining us. I'm Julie Musgrave. March 19th is Certified Nurses Day, celebrating RNs who have taken their careers to the next level through extra time, education, and training. We're spotlighting just a few of the many certified nurses serving patients now at community medical centers. Hundreds of nurses working in dozens of specialties.
I'm on the med-surg floor.
Informatics.
Representing that extra mile at community medical centers. These medical professionals are not just nurses, they're board certified.
The reason it's very important is it actually affirms that nurse's knowledge in that specialty of nursing and contributes significantly to safety and quality of care for our patients.
Getting that certification requires a certain number of hours working in a specialized field, ongoing education, then passing a detailed, challenging national exam.
It's invaluable. Having certified nurses allows us to continue to not only provide superior patient care, but they're able to impart that knowledge to their fellow nurses as well and raise the competency of everyone in the unit together.
I just thought it was important to continue my education and make sure that I have that extra certification just to show that, I'm proud.
Over at Fresno Heart and Surgical, Carrie Niehoff says that C in her CRN title carries with it another level of trust in her bariatric skill set.
When they come in, I can almost recognize and identify and predict what the doctors are going to order.
Certification is not required for employment at community medical centers. So when a nurse achieves that status, it signals an internal drive to keep getting better, even after 42 years, like Margaret Wild.
Every day we have different technology. It's new, it's different, it's never boring.
Wild has been board certified since 1991. She works in the operating room at Clovis Community Medical Center.
You have to know sterile processing, you have to know perioperative, pre-op, inter-op, post-op, all of that. For me, I feel that I am a better asset to them for the nursing process, to evaluate them, to feel, empathy for them also.
Empathy and knowledge are two big components of nursing through every stage of life.
The NICU is intensive care. So you're typically dealing with babies that are quite sick, unstable, they're very early.
Diana Cormier, a clinical nurse specialist at Community Regional's NICU, calls certification an investment in your career.
And once you're done with nursing school, you start at a job, you orient, you train, you get comfortable with your skills, but it's challenging to keep the information fresh and to keep learning.
Diana now travels nationwide, learning best practices, the latest research, and staying on top of what's best for even the tiniest patients.
We are committed not only to keeping up with healthcare, but getting ahead of it.
Even through the nurses of tomorrow, many of whom are taught by Bridget Bousquet-Hein.
It provides us with a sense of confidence.
Education is her passion. She's a nurse educator at Community Behavioral Health Center in Fresno.
When I think about it, how we nursed when I was a new nurse and how we nurse now is very, very different. We're very focused on evidence-based practice, and certification requires that you stay current with changes that are occurring in your area.
Which Bridget says should give patients a level of comfort and confidence that they're being taken care of by the best.
You know what? I am proud to be a nurse, and I want to pursue nursing, and I want my knowledge to be at the highest level.
That pride is why Community Medical Centers is recognizing every certified nurse in every specialty.
It's just an incredible profession.
For their ongoing passion for nursing.
We've not only invested in ourselves, we're investing in you.
Community encourages and supports nurses who are interested in becoming board certified by offering mentoring and reimbursing their educational costs. For more information, talk to your department manager or educator.